Imagine this, it's a quiet morning, and you're pouring yourself a cup of coffee. The sun is just beginning to spill through the kitchen window, and everything feels normal, until it doesn't. Your hand feels strangely heavy. You shake it out, blaming it on the way you slept. Seems harmless enough. But what if that small, seemingly insignificant moment was your body's first attempt to get your attention? What if that tiny physical glitch was actually a warning, one you were never taught to recognize? Far too often, we brush off symptoms like these, not realizing that our bodies have already begun telling a story. A stroke is often thought of as a sudden event, an invisible line between fine and forever changed. But the truth is, strokes rarely come out of nowhere. In many cases, the body quietly warns us days or even weeks in advance. And the earlier we learn to understand those signals, the better our chances of rewriting the outcome. Every 40 seconds, someone in the United States has a stroke. That's more than just a number. That's a spouse, a parent, a friend, a future altered in an instant. But the body doesn't go silent before disaster, it drops clues. Sometimes those clues are quiet. Sometimes they're strange or subtle. But they're there. And when we learn to listen to them, we're not just protecting our lives. We're protecting our ability to live fully. Take fatigue, for example. Not just the kind you feel after a long day, but a bone-deep exhaustion that doesn't match your activity level. You're sleeping enough, eating okay, but your energy is missing. It's not just tiredness. It's like someone dimmed the lights inside you. This kind of unshakable fatigue, especially when it lingers without explanation, can be a sign of reduced oxygen getting to parts of the brain. And that's just one of many early warnings people tend to ignore. Next is vision, something we often attribute to screens or aging. But if you suddenly find yourself struggling to focus, seeing double, or noticing blurriness in just one eye, that could be more than simple strain. Floaters, flashes, or needing to turn your head more to see clearly on one side may indicate that the part of your brain that processes vision isn't getting enough blood. One person even shared how they began shifting their head slightly, not realizing that one side of their visual field was fading out. These little adaptations mask real issues. Then there's mental fog. Not the occasional forgetfulness that comes from being busy, but repeatedly blanking out during conversations or forgetting what you were just doing. Maybe you find yourself feeling confused in familiar places, or can't quite follow the thread of a TV show or a book. These cognitive slips often get attributed to stress or aging, but they can be early signs of interrupted brain function. Another warning sign is imbalance or dizziness. It's easy to chalk it up to low blood sugar or standing up too fast. But if it keeps happening, especially when you turn your head or rise quickly, it could indicate issues in the part of your brain that controls coordination. There's also something more emotional, and harder to describe, a sense of being off. You might feel like you're watching yourself move through your day instead of fully participating in it. Some people describe it as feeling detached or like they're not fully present. It's eerie, and often dismissed as stress or fatigue. But changes in how you emotionally process your surroundings can also be neurologically driven. And then there's sleep. Trouble falling asleep, staying asleep, or waking up frequently for no reason may seem unrelated, but when combined with other symptoms like fatigue or brain fog, it starts to look like a pattern. Your brain regulates your sleep through oxygen and hormone balance. If either is your sleep quality suffers. Add to this sudden emotional changes, like bursts of irritability, crying without a clear reason, or intense anxiety, and it starts to become clearer. These aren't just mood swings. They may be evidence of something deeper, affecting emotional regulation centers in the brain. Now, here's what makes this complicated. Each of these symptoms can exist on their own for many reasons. But when they appear together, increase in frequency, or have no obvious cause, that's when the alarm bells should go off. Your body isn't being dramatic. It's trying to help you. And if we fail to pay attention when it's whispering, we risk facing a much louder wake-up call. One of the most dangerously misunderstood warnings is something called a transient ischemic attack, or TIA, what some call a mini-stroke. These events happen when a temporary blockage in the blood flow to the brain causes sudden symptoms that resolve quickly. Maybe your arm goes numb for a minute. Maybe your SPI. Sometimes just seconds, and often vanish before someone even considers medical help. But here's the truth, they are not harmless. A TIA is not a lucky miss, it's a red alert warning. Research shows that over 40% of people who go on to have a full stroke experienced a TIA in the week leading up to it. These are not isolated incidents. They are fire drills for an emergency that may be just around the corner. Imagine typing at your desk and your fingers stop responding properly for a moment. You shake your hand, and everything goes back to normal. Hours later, you forget a word you use every day. It comes back to you, so you move on. But these small episodes are your brain crying out. And the most dangerous part? They fool you into thinking everything's okay. But if you've had one TIA, your stroke risk multiplies, especially in the next 48 to 72 hours. That's why even a brief episode of weakness, confusion, or vision change should be treated as a medical emergency. Not next week. Not when. Let's talk about some real people. A woman in her early 60s walks into the ER. Earlier that morning, she couldn't lift her arm to brush her hair. 2 days before, she was dizzy getting out of bed. The week before that, a piercing headache woke her up at 3 a.m. And for days before that, she felt unusually tired but blamed it on her age. Now, with all the pieces lined up, it's obvious. But at the time, nothing seemed urgent. Another patient, 47 years old, healthy, active, woke up and dropped her coffee mug because her hand didn't respond. By noon, she felt fine. She skipped the doctor. 4 days later, she had a full stroke during a video call. Both women said the same thing, if only I had known. That's the painful truth behind most stroke stories, not that there were no signs, but that they weren't understood. And this is where your personal health history becomes crucial. Because not all symptoms mean the same thing for everyone. 2 people might have the same headache, one is fine, the other is days away from a stroke. The difference? Context. High blood pressure is the biggest stroke risk factor. If your numbers are regularly above 130/80 and you experience visual disturbances, don't wait. Diabetes, too, damages blood vessels slowly. For someone with elevated blood sugar, even mild fatigue or tingling is more serious. Then there's sleep apnea. If you snore loudly, gasp in your sleep, or wake up exhausted, that condition is silently reducing oxygen to your brain and increasing stroke risk. High cholesterol builds plaque in your arteries. Add smoking, lack of exercise, and alcohol, and your risk grows exponentially. And if you're over 55, or have a parent or sibling who's had a stroke, your baseline risk is already higher. In other words, your body is speaking. And the way it speaks depends. The best part? You can act now. You don't need perfection. You need consistency. Reduce salt intake to help your blood pressure. Manage your blood sugar with fewer processed carbs and more whole foods. Move your body, 30 minutes of walking a day makes a difference. Monitor your blood pressure at home. Track it. Understand it. Prioritize sleep and get checked for apnea if you wake up tired. Check your cholesterol, eat more omega-3s and fiber, and if prescribed medication, take it. And most importantly, stop smoking and limit alcohol. These steps don't just prevent stroke. They protect your memory, mood, focus, mobility, and quality of life. Because here's the final truth, prevention isn't dramatic. It doesn't get headlines. But compared to recovery, it's the greatest gift you can give your future self. You are not powerless. Your body has already begun the conversation. You just have to listen. You are the author of your own health story. And it's never too late to write a different ending.